Yesterday, another strong day of testing, 3,432 tests conducted across the ACT, giving us a good level of surveillance of the virus spread across the territory. As always, please come forward for testing if you have any symptoms or if you have been at one of the exposure sites during the times identified. Across ACT Policing, Access Canberra and WorkSafe ACT, the strong compliance program continues. Yesterday there were 433 traffic stops by ACT Policing, with 4 directions issued to leave the ACT. Business compliance remains very good. ACT Policing conducted a program, nearly 50 checks. Access Canberra and WorkSafe ACT were busy in other priority areas across the business community. Once again, checking in remains one of the areas that we are focused on. It's an important part of our public health response, and Minister Stephen Smith will talk some more shortly about the changes and updates to the Check-in CBR app. We are particularly asking people to check in at supermarkets, check in if you've been on public transport, and even checking in at things like playgrounds and dog parks. This process, the QR codes, and being able to contact trace is going to continue to be a part of our lives for many months ahead. On the vaccination front, some more great news to report. Now 92% of staff in ACT residential aged care have received a first dose of the vaccine. 95% of residents, almost 95%, have now received a first dose, and just under 90% of residents are fully vaccinated. In the next 24 hours, the ACT will reach 50% of our population 16 years and over fully vaccinated. Over 50% of 30 to 39-year-olds have now had a first dose of a vaccine. Over 40% of 16 to 29-year-olds have now had a first dose. Now, this is a really encouraging start to the vaccination program for under 40s. But as these figures bear out, there are still people who have not yet had access to a vaccine, not yet had access to the level of protection that vaccination provides, and it remains the government's very firm view that these people should be given that opportunity before we make significant changes to our public health directions. We are continuing to ask anyone in the priority groups, including residential aged care, healthcare workers, teachers, early childhood workers and Year 12 students to take advantage of the priority that you have to get vaccinated and to make those bookings as soon as possible. Now, in planning for the months ahead, I want to provide some further information for the community on that work and where we are going next. In the simplest possible terms, the next 8 weeks are a race to get as many people fully vaccinated as quickly as possible. As our vaccination rates increase, it is the government's intention to make gradual steps forward to manage our current outbreak. So we will be able to ease public health restrictions as our vaccination rate increases. The clear advice is that we will need to maintain many public health measures for the weeks ahead. We will outline the next steps on Tuesday of next week. I want to assure everyone that the path we will take will be informed by the health advice. Our approach will support a gradual and safe reopening that supports people back into work. Details on Tuesday of next week. In summary, for those who've joined late, we recorded 15 new cases, 13 of them linked, 5 in quarantine for their entire infectious period, at least 8 infectious in the community for some time, 2 still under investigation, 9 people hospitalised and 2 in intensive care, 1 at the Calvary Intensive Care Unit. And we thank the wonderful staff at the Calvary Intensive Care Unit for the support and care that they are providing that person.